Good morning, ladies and gentlemen. My name is István Baradács, and today I will present the 15th-month progress of my PhD topic, which is the targeted therapy in ovarian cancer. First, let me introduce our team. I'm a resident doctor at the Department of Obstetrics and Gynecology at the Semmelweis University. My supervisors are Balázs Lindner and Ferenc Bánhidi. Our SMS is Brigitte Deutsch, and the statistician is Alex Váradi. My vision is that the molecular targeted therapy could completely change oncological treatment. The mission behind my work is to learn about the possibilities given by the individualized targeted therapies and bring the knowledge back to the bedside. We have started to work on two different projects. The first one started in September 2021 and the second one started in January 2022. I would like to continue my presentation with our first project. It's investigating the efficacy and safety of PARP inhibitors therapy in advanced ovarian cancer, and it's a meta-analysis. I would like to give you some background for our first project. Over 75% of the cases, ovarian cancer is diagnosed at an advanced level, and with standard chemotherapy, relapse occurs in 70% of the cases. These facts highlight the need for a new effective therapy for these patients, and based on recent clinical trials, PARP inhibitors hold the potential to be this new therapeutic lines, and they showed significant improvement in median progression-free survival. Our aim is to assess the efficacy and safety of PARP inhibitors in advanced ovarian cancer. Our clinical question is that do PARP inhibitors provide better progression-free survival for patients with advanced ovarian cancer or patients and newly diagnosed ovarian cancer patients and relapsed ovarian cancer patients? And the intervention is PARP inhibitor therapy. The control is the placebo, and the outcomes are progression-free survival, overall survival, and adverse events. Our hypothesis is that PARP inhibitors provide better progression-free survival and are well tolerated. We ran our systematic search in the middle of April 2022, and it resulted in 21 eligible full text for our meta-analysis. And during the statistical analysis, over 80 forest plots were born. And in the following, I will present you the pooled hazard ratios for several forest plots in aggregate. In this slide, in the columns from left to right, you could see the therapeutic setting, the pooled hazard ratios, the statistical heterogeneity, and the certainty of evidence. And based on this table, you could see that in almost every patient population, PARP inhibitors increased the progression-free survival or decreased the risk of disease progression, and the results are statistically and clinically significant. On the next slide, you could see the adverse events in newly diagnosed ovarian cancer. It's not surprising that compared to placebo, the PARP inhibitors increased the risk of severe adverse events, but we have to mention that, we have to highlight that with the PARP inhibitor therapy, these adverse events could be managed with dose modification, and treatment discontinuation and treatment intervention was needed in a lower portion of the proportion of the cases. As we arrive to the summary, I would like to mention the strengths and limitations of our meta-analysis. So our study was based only on RCTs. We had homogeneous populations and clinically important subgroups with new results, and the overall risk of bias was low. On the other hand, there were minor differences in intervention, and in some cases the overall survival data was unavailable, and the follow-up time was relatively short. In conclusion, The PARP inhibitors demonstrated an improvement in the progression-free survival, and despite the increased number in serious adverse events, the therapy was well tolerated. Both primary or recurrent ovarian cancer patients responded favorably to the PARP inhibitor treatment, and the adverse events management is not automatically means that we have to stop the therapy or discontinue the therapy. The adverse event could be managed with those modifications too, and the therapy could continue with this. So there are some unanswered research questions like the progression-free survival prolongation in BRCA wild type patients, and the best timing of the PARP inhibitor treatment is also controversial. And if we won't have big progress with the PARP inhibitors in the future, we should turn our attention to the combination therapies with other targeted drugs. We submitted our manuscript to the Gynecological Oncology journal, and it was rejected. So we will send it to the next paper on our list. I would like to continue with my second project. It's investigating the efficacy and safety of anti-VEGF plus PARP inhibitor combination treatment in advanced ovarian cancer. And as I mentioned before, this disease is characterized by late diagnosis and high relapse rate. And in addition, there are limiting factors for the patient to receive multiple lines of platinum-based therapies like myelosuppression, neurotoxicity, or allergy. This combination could may hold the potential in the future to give these patients chemotherapy-free combination or treatment. And on top of that, these two types of drugs may improve each other's effects in this patient population. The aim is to assess the efficacy and safety of the combination treatment in ovarian cancer. Our clinical question is, do the combination therapy provide better progression-free survival? Or patients are diagnosed with advanced ovarian cancer. The intervention is the combination therapy. The control is the placebo alone or chemotherapy alone. Or outcomes are progression-free survival, overall survival, and adverse events. And the hypothesis is that the combination therapy provides better progression-free survival and safe for the patients. As a progress for the second project, we ran the systematic search and extracted the data, and soon we will send the tables to the statisticians. So the planned submission date for our first study was December, and for the second one, we are planning to submit it in February 2023. And I would like to close my presentation with this quote: wherever the art of medicine is loved, there is also a love of humanity. Thank you for your attention.